Well, welcome back, everyone. Surgical Partners, Orthopedic Surgical Partners is dedicated to delivering superior orthopedic care right here in Connecticut, and that's why they utilize the latest and the most advanced procedures for patients.
Recently, they became the first on the East Coast to use a revolutionary material during shoulder surgery. Our Lauren Richardson has the story.
38-year-old Nicole Gatome noticed a bothersome shoulder pain after carrying her dog up a flight of stairs. It kept continuing.
There was the sharp stabby when you moved it wrong, but there's also a lot of like deep throbby kind of pain. That was kind of the more like lingering stuff. You'd move your arm too high, you'd reach for something wrong, and you'd get a very sharp pain, but then it would ache for quite a while afterwards.
After making a call to Orthopedic Surgical Partners in Rocky Hill, she explored her options.
I got in to see Dr. Risigner, and he said, we'll try 2 weeks of physical therapy, but given your history, it might be something else. And after 2 weeks, it actually was getting worse. So then I called him and I said, I think it's time we look at the replacement.
Dr. Randall Risigner is an orthopedic surgeon at OSP.
So essentially, shoulder arthritis is very common, mostly in people over the age of 60, though. About 1 in 3 people will have arthritis in their shoulder over the age of 60, but for young people, it's different. Younger people can get it mostly if they lift heavy in life, but also other conditions.
When we talked about the shoulder, and he said, well, with current technology, in 20 years, you're going to have another surgery. And then 20 years after that, you're probably going to need another surgery. And you start doing the math, I'm like, well, that's 60, and then I'm going to at 80, and like that's a lot to have to think about in the future.
But the FDA was working on approving a new material for shoulder replacements, and Dr. Risigner told Gatome this could be a game changer.
This is a new material called pyrocarbon, which was FDA released in April, and Nicole was the 3rd patient in the country to receive this replacement. And the hope is that by doing this, it'll last far beyond 20 years for her.
I was a little hesitant at first, but when he said, you might not need to have another surgery, I was like, well, that's a win, Or even if it takes 30 years before I have to have another surgery, that's a win. I'll take any time I can get.
So this is the actual part. This is titanium, and this is the pyrocarbon surface. So this is a graphite core with pyrocarbon on the surface. And the interesting part about this is it's a softer feel than what we normally use, which is titanium covered with cobalt chrome.
Dr. Risigner uses advanced imaging and also does an evaluation to see if a patient would be a good candidate for shoulder replacement surgery.
When somebody comes in with shoulder arthritis of any type, we try conservative care, right? That involves therapy, injections, non-steroidal anti-inflammatories, and those can often avoid surgery for a while, but when it leads to surgery, satisfaction rates after shoulder replacement are more than 90%, so it's a good option.
The surgery takes about an hour and a half, and the healing process takes about 4 to 6 weeks after the procedure.
The first week was really hard, but after that, it was pretty easy, actually. I was surprised at how quickly I got back to being me and doing what I normally do. It was 3 weeks, I think 3 weeks before I went back to work.
He has now used the pyrocarbon on 2 other shoulder replacement surgeries and is very hopeful for the future of this new material.
The difference with the material is we normally use titanium with cobalt chrome on the surface, which is a hard material. This material is softer. It's more like native bone and cartilage. And early science says the body reacts to that better, meaning it doesn't wear out as fast because it is more like native tissue, right? So we don't have 30 or 40-year data, but anything that can last longer is better for a young patient.
Looking forward, it's a more optimistic viewpoint for Gatome and others embarking on this process.
That's actually a bit of a relief, knowing that, okay, the shoulder is done, it's not going to bother me again, we're all set. It's kind of oddly nice to know that this should be hopefully at the end for me on that shoulder.
And just a reminder, Orthopedic Surgical Partners has offices in Rocky Hill, Manchester, Avon, and Willimantic. So for more information on the services and this new kind of shoulder replacement material, you can go right to the website. It's ospct.com, or give them a call, 860-525-4469. Just tell them Great Day Connecticut sent you.
So interesting.
Yeah.